Okay, good morning, everybody, and you're all very welcome to our press conference, the press conference for the Independent Scientific Advocacy Group in Ireland. The ISAG Group is a multidisciplinary all-island group of scientists, academics, and researchers who have come together to advocate for a SARS-CoV-2 elimination strategy across the island of Ireland. We're delighted to have members of the group with us here this morning, and we'll be delighted also to take questions from the attendees over the course of the next 30 minutes or so. I'd like to direct the attendees to the Q&A function on Zoom. Many of you are probably already familiar with this to date. We'll pass over to Professor Anthony Staines in a moment, but if you have any questions that you'd like to address to any members of the group, please feel free to use the Q&A and we'll take those questions after. Thank you. Anthony, over to you.
Thank you very much. Our core message is very simple. Let this lockdown be our last. We're now into the start of our third lockdown. We anticipate the Cabinet will announce later today lockdown starting either a few days after Christmas or at the beginning of the new year. Each of these lockdowns causes considerable disruption to the economy, considerable disruption to society. They lose jobs and they lose businesses, but they're necessary because if we don't do something drastic, the virus will overwhelm our health services. And if you want to see what this looks like, you don't have to go far. Northern Ireland has hardly any hospital beds. The north of England has had no hospital beds for several weeks. In the south of England, the hospitals are filling up rapidly. This means that people who need other types of care are not getting it. This is not inevitable. We can do something about this. The way European countries in general have managed COVID-19 has been a failure. Ireland has done better than many of our European peers, but as I speak to you, our latest estimate of the R value is now 1.7, and it's gone up from 1 8 days ago. So this is a virus which is spreading rapidly and spreading faster. But we are not trapped by this virus. Our future lies in our own hands. The government, I believe, will decide to have a serious lockdown. And there is a plan which says we will have a lockdown, then we will open up, and the virus will go up again, then we'll have another lockdown, then we will open up, then we will do it again until vaccination comes. And that would be a reasonable plan if we were sure people would be vaccinated by March. But the Taoiseach has said, as recently as last Friday, he anticipates mass vaccination will begin in August. I just want you to let that sink in for a moment. Mass vaccination in August means we do not get back to normal life probably till November of next year. So if everything goes well, everything runs smoothly, we will have a good Christmas in 2021. But over the summer, many industries will go under. The hospitality industry will be very badly damaged. Hotels will be very badly damaged. Many small businesses will be very badly damaged. And the government's view is that's acceptable because it's too hard to control the virus now. And you can understand their concerns. We share a land border with Northern Ireland, a border which is effectively permeable. We have many people flying in and out of our country every day. But other countries have faced these challenges. Australia, for example, is more dependent on foreign travel than we are. A substantial proportion of the Australian labour force flies in and out on a regular basis. Australia is more dependent on tourism than we are. Australia has internal state borders which have not been closed in over a century. But the Australians took the courageous decisions. They took the pain up front and they closed their borders. If you fly into Australia now, you will quarantine in a hotel for 14 days. That's what we need to do here. If you want to cross an Australian state border, you have to have a reason. Now that has changed as the virus has gone to zero across Australia, and you can now cross Australian state borders freely. But for quite a while, the borders were closed. Many aspects of Australian life were severely disrupted for a period of time, but it's back to normal. Australian horse racing is open. Australian footy is open. Australian restaurants, shops, pubs, parties are open. My Australian colleagues are wondering which beach they'll have their barbie on for Christmas, which would be a nice problem for us to have. We are not taking these firm, decisive actions. We have a clear plan. We start as soon as possible. We bring in significant restrictions, a level 5 lockdown. We bring in quarantine at the airports. We bring in checks at some distance from the border, not for people who travel across the border every day for work. We have a separate system for those people, but for people who are crossing the border, essentially for recreational purposes. And all of this is entirely feasible. We beef up public health. The most striking thing for a public health doctor like myself about the Irish infections is the huge number which are of unknown origin. They're household infections or community infections. And this is a polite way of saying this person got infected and we've no idea why. So we bring in proper contact tracing. So if you become infected, we try to find out how, why, and where. I expect that it would be beneficial to make a decision to close the schools for the month of January and to open up the schools in February and run the leaving certificate 3 or 4 weeks later, the middle of June, beginning of July. This is not impossible, and it will help us bring the numbers down faster. Looking at our figures for the last 2 weeks, the number of cases in those aged 15 to 24 is rising sharply, and this is being driven by schools. So we have a set of proposals which we believe will bring us back to normal, will make the next lockdown our last lockdown. And we will be back to everyday life with some challenges by St. Patrick's Day. The biggest challenge is there'll be very few foreign tourists coming into the country. But the reality is there'll be very few Irish tourists going out because we anticipate there'll be severe travel restrictions. European countries are looking for someone to take a lead on this. With colleagues, we have an article in the Lancet last week calling for a Europe-wide response to COVID-19 along the lines I'm describing for Ireland. Clearly, each country does their own, but we need political leadership. Our Taoiseach Micheál Martin has form in this area. He's already provided substantial political leadership around smoking, and that's had more of an effect across Europe. Look to Ireland for public health leadership at political level. This is an opportunity again for our government to lead the way, to take decisive actions, to say, we are going to do this, we are going to make this our last lockdown, we are going to get most of our lives back by March of this year. And that will mean that the hospitality industry, the tourist industry, and many small businesses that will otherwise close over the summer will survive and still be around, giving employment in a year's time. Thank you.
Thank you very much, Anthony. I think that's kind of given a very good overview of the different issues at stake. I'd like to maybe move across to Professor Gabriel Scally, maybe to offer some thoughts on this. And I know, Gabriel, you've been advocating for an all-island approach as well for quite some time. Sorry, Gabriel, you might want to unmute your mic. Thank you.
Inevitably. Yes, thank you very much for inviting me along. I think we are at a most difficult phase, as Anthony has clearly stated. Uh, the virus is on the rampage now, and you can say nothing else but that in across parts of the UK and across parts of Europe. The Republic of Ireland has done extremely well in the autumn in keeping it suppressed to a reasonable level, but nonetheless, at any time, it can get out of control. One only has to look at what has happened in Northern Ireland. I find it deeply distressing, the pace of growth in Northern Ireland and the failure to deal with it. And it does pose an enormous problem for the island of Ireland. And it's the island of Ireland that provides the solution to the problem. When you list the islands of the world and you go through their performance in COVID, Britain and Ireland sit up at the top of that poor performance league, because neither island has taken advantage of what it should have made a feature of, which was its ability to control its borders, to contain cases, and to find those cases and deal with them. So we're in a really difficult situation, but one that is soluble. And it does depend on going back to the public health basics, which are the proper measures of hygiene, and particularly taking account of the change in the nature of the virus, or in our understanding of the nature of virus since it began. Everyone will remember that started off as something that we thought was droplet spread and was going to be spread by both coughing, sneezing, and touching surfaces. And now we are very clear that it is much more complex than that. It is an airborne virus, and that airborne transmission is extremely important. Nonetheless, we haven't seen what we should have seen in response to that. We haven't seen a reinstitution of a very firm 2-meter distancing rule, and we haven't seen sufficient attention being paid to issues of ventilation, which are extraordinarily important and haven't received neither the attention nor the investment that those issues need. Anthony's already spoken about the issue of testing and tracing. And in fact, it needs to be a fully fledged system, from finding cases, actively going and seeking cases, finding, testing, tracing, isolating, and indeed supporting people as well, so that they are enabled to isolate. And we haven't seen that system operated properly in these islands. And in fact, in Northern Ireland, we know from the recent BBC Spotlight documentary, which is well worth watching, about how poor, how dreadfully poor the contact tracing system is with their digital, what is called a digital first system, which means that people simply get a text message when they're being traced as a contact, and that is largely it. And that's proved appallingly inadequate, as have also the imposition of social distancing measures, etc. So it leaves the island as in a really difficult state. The emergence of a new variant is nothing new. It happened last summer with the Spanish variant, which spread rapidly across Europe because we didn't do anything to deal with the free transmission of the virus or importation of the virus. And it became the dominant variant in many places at that time. It is possible that this one is indeed more infectious, and that causes new problems for us, but it doesn't take away at all from what people like the group you had before you are saying about the fundamentals of getting this virus under control, firstly, and then fully suppressed and eliminated from our islands. In fact, all it does is heighten the need for that to happen, because it increases, if it is more infectious, it increases the risk of health services being overwhelmed. And this calamitous state that we find ourselves in, these islands being turned into an absolute tragedy. So it's never been more important now to take the effective measures, and the effective measures are quite clear. They're about control of movement, and they're about the imposition of very strict social distancing measures until the virus load on the population goes down dramatically and we get it down to zero. I think of all the disappointments I've had in a long career in public health, no disappointment matches the disappointment I feel about the inability of my country, Ireland, to deal with the virus last summer, when deaths were at zero, both north and south, and when cases were in single figures in the north and in the teens in the Republic. And that failure will go down in history as a tremendous failure of the body politic across this country. And it shouldn't be allowed to continue. We should have learned from that. And at this point in time, I would call for an immediate North-South political summit to decide on a range of measures working integratedly, North and South, to get this virus under control and eliminate it from this island. Unfortunately, the memorandum of understanding that was signed some time ago has clearly turned into a memorandum of understanding that nothing will happen. And that is not good enough. And I think our politicians, North and South, need to, as a matter of urgency, start listening to the voices that are talking sense on the elimination of the virus and not listening to vested interests, but to get us to a stage within 2-month period where we can resume life as it should be on this island, with all the controls that will be necessary, but life will be changed immeasurably for the better. And that will be very necessary until immunization is rolled out. Thank you very much for inviting me along today.
Thank you very much, Gabriel. I might move over to Professor Sam McConkey, maybe just to offer some thoughts on that as well, please. And Sam, you might unmute your mic. Thank you.
Thanks, Vanessa. I think what maybe I'm hoping all of us in Ireland have learned is that the situations we've been in the last sort of 9-12 months have not been at all stable. Our current strategy is leading to very much instability in the viral transmission, the number of cases, the number of deaths, and then the level of restrictions. So where businesses and restaurants and pubs and everything else is facing unexpected restrictions at times when they don't want them and haven't planned them. And that level of instability, in my view, makes many aspects of our life, whether it's social life or culture life or music, religious life and business and education, very, very difficult when you have this, we don't know what we're going to be doing in 2 weeks' time type of situation as we're in now. So my view is the only way to get any sort of predictability and stability with this virus is really a firm control for probably approximately 6 to 8 weeks based on the experience in New Zealand and Australia. I think that we're in a slightly better place now than we were on the 24th of March. So even though the number of cases diagnosed yesterday was larger than the 24th of March, the true number of cases on the island is less because we had a large number of cases undiagnosed then. So I think it will come down quicker. I think we need a shorter period of harsh restrictions to get to a stable place. And that's why I'm strongly supporting this zero COVID strategy.
Thank you very much, Sam, for that. I might move over to Professor Aoife McLysaght. I know, Aoife, you were on the radio this morning with Ciara Kelly, and you were also talking about different kinds of restrictions and for how long as well. And there's different kinds of intakes of breath when we realise we might be going to 3, 4, 5, 6 lockdowns. Any thoughts on what we've been talking about?
Well, I think, the cost of the current strategy or lack of strategy has become quite clear, and that's we're going to keep cycling in and out of these lockdowns. And this particular example is, I think, the most shocking and disturbing to everybody because we feel like we've only just opened up and we're in crisis once again. And I think everybody agrees that this isn't something that we can live with for 2021. And I think that now, I think the people in general do agree that what we need is to take control of the situation with something like a hard lockdown, and then to bring in all of the other controls that we need, the test, trace, isolate that's been mentioned already, resourcing the public health doctors properly so that we can keep a stable situation. Like Sam just mentioned, this instability is really not possible to live with. And we've been in the situation when we've been pitting different parts of the economy and different activities against each other. And this is not something that we want to do or we can sustain. So I think the public appetite is there. I think people are sick of lockdown. And I think, and I fully understand that. And I think they do understand that we need to get this under control with one last lockdown, and we want to make this lockdown our last. And this means doing it well, and it means resourcing all of the other aspects of public health. It means quarantining or managing, international arrivals, which is a smaller inconvenience, I think, than the significant inconvenience that we've been experiencing with essentially, quasi-permanent lockdown now for quite a few months. So I think there's the public appetite to do this, and we need the politicians to respond, and we need them to respond urgently, because the numbers are really quite frightening at the moment. That's one thing, but we also have a golden opportunity now, which is the fact that Northern Ireland are entering into a 6-week lockdown. The challenge has always been to coordinate with them. They're doing something we can just unilaterally coordinate. And there's also the fact that the schools are closing today for a scheduled closure anyway. So we have a few things stacking up in our favor that we could take advantage of. And I think that's why we wanted to talk today, because it's urgent in terms of the case numbers, and there's a specific opportunity with regard to coordinating with Northern Ireland.
Okay, thank you very much, Aoife. And I think just in terms of the press release that we sent out last night, we identified today as a really important day to raise these issues, but also that there's kind of an expiry date on the opportunity that we have here, and the expiry date will probably run out after the 26th of December for that opportunity for us to go into lockstep with our friends and neighbours in Northern Ireland. The question of data came up, so we might go to Paul in a moment, but I'd like to move to Tomás Ryan. Tomás, would you have any comments or observations so far?
I think what Aoife said is exactly right. This is a golden opportunity to take control of our situation in the pandemic. For the first time, the stories that we tell ourselves and the stories that we tell each other in the media have been couching how we think about how we can manage COVID-19 in Ireland. But recently in particular, we haven't been paying enough attention to what is happening in other parts of the world, because all of Europe is failing badly on this problem. From the beginning, a subset of Asian countries handled this very well, and we applied a kind of European exceptionalism in saying, well, that's a different situation. But right up to today, we are not paying enough attention to what life is like in Australia and New Zealand on one hand, and in the United States of America on the other. The last few weeks in the USA have been amongst the most tragic in the country's history. And we're not paying full enough attention to what is happening in this country, which has, despite inequalities, a much more well-resourced healthcare structure than we do. And we're not paying enough attention to what is happening in Australia. And the reality is that Australia, being an isolated continent, means that it relies on its airports as much as we do. It relies on international transit as much as we do. But it made the difficult decision to make that sacrifice for the reason that it would open up the domestic economy. I think we need to level with ourselves that this is a possible choice for us. It is in the best interests of most of the population in terms of people's mental health and in terms of the economy. The only question that we should be thinking with respect to this aggressive suppression strategy is not, is it good enough for the economy? We've gone past all the false stories and the false dichotomies about whether this is going to be bad for the economy, whether this is too idealistic. We know it works in other countries. We know it is the only strategy that can open the economy. The only reasonable question is, can we do it in Ireland? Can we rely on the government to do it? Will the citizens have confidence in the government in carrying this out? And the government a few days ago crossed a significant Rubicon when it banned travel from Great Britain, from our major source of visitors, which is an historic event by any measure. So as long as the government make a strategy that from the outset makes a commitment to regulate international travel, not stop it, but to enforce in a serious way 2-week quarantines, then we can expect the population to join us in following Northern Ireland and having a collaborative lockdown, which we can have confidence based on the difficult choice of travel restrictions, will also result in a stable test trace isolation infrastructure and a situation that we can maintain going into February without having a fourth lockdown.
Thank you very much, Tomás. What we might do now is maybe move very briefly to Oisín O'Connell. Oisín, if you'd like to offer some thoughts. I'll take some questions as they're coming in as well from the Q&A function, so do feel free, please, to add them in, and we'll open it up for a general discussions once we've had the general overviews completed. Oisín.
Hey guys, hopefully you can hear me now. Actually, the sound's gone poor on my own, so tell me if you can.
Yeah.
I suppose in terms of things that have been mentioned so far, the importance of a North-South political summit, I think, is critical. I think the North is entering a new phase and a lockdown. And I think from the get-go, there's been very poor collaboration nationally by our government in terms of coming up with a national strategy. And because of this, we've had very poor understanding of commuter zones, we've very poor understanding of borders, and we've actually shown fairly poor leadership in the ability to actually control COVID. I think we have to get some terminology correct. We have to distinguish what are mystery cases, as we've called them, community transmission, from what public health can deal with. Public health can only deal with what are traceable chains of transmissions, and they can only do it when there's controlled numbers. We've referred to community transmission, which we really should have referred perhaps to mystery cases, because we've no idea where they come from. And if you've no idea where something comes from, you can't chase the train. And because of that, we've actually settled on mediocrity, and we've not gone after chasing those trains, and we haven't adequately resourced public health to work like a surgeon and scalpel out the chains. Now, a few other kind of things I think that we need to think about in that regard. One, we need to think of commuter zones. We need more mobility data. We need better understanding that it is humans move the virus. I also think intrinsically Irish people are risk takers, and there's that sense of it's not going to happen to me, you know. So where Australia have been rigorous in their quarantine and it's extremely strict and they've gone after every case, Ireland is very blasé and has never taken those stringent rules and has never had the political appetite to do it. Finally, I think in terms of ventilation, it's something that I think is poorly understood. And my own analogy that I think people need to understand better is that it's like cigarette smoke. If you can smell cigarette smoke in a room after a person's been in it, then it's probably poorly ventilated. Same concept goes for COVID. That goes from classrooms to workplace environments. If somebody was smoking in the room before you and you can smell it, that's a poorly ventilated room. Same way as you have to assume that the person that you're talking to is an asymptomatic transmitter. We know that there's 48 hours before you've displayed any symptom, you've got the highest viral load. So that's why we keep getting back to this concept of basically assume everyone is a latent transmitter. But I think those things have been forgotten a little bit about in terms of the success in the vaccine and the speed it's coming out. We're paying too much heed to the vaccine and not enough to the duration before this is going to result in any normal economic activity again. Thanks.
Okay, thank you very much, Oisín. We've been talking a little bit about our friends and colleagues in Northern Ireland, so we're delighted to have Andrew Kunzman here with us as well this morning. Andrew, I might invite you to offer some comments and observations, please.
Thanks very much. So one of the comments I was going to have is that COVID has had an enormous impact on cancer services across the island. Often individuals living with cancer or displaying cancer symptoms are particularly vulnerable to COVID, which makes it incredibly difficult to ensure the early diagnosis and maintain optimal care. Early diagnosis is essential for the effectiveness of treatments for cancer. And estimates from the Northern Ireland Cancer Registry suggest that we've either missed or delayed diagnosis for over 1,000 patients so far this year. That number is likely to be even bigger in the south of the island. That number will continue to grow if we continue to make hospitals, GPs, and patients choose between seeking care for their cancer symptoms or being fearful of COVID or passing on COVID in hospitals. It will continue to grow if we continue to confuse persistent cough for COVID rather than lung cancer. And all of the other issues that cancer patients will face will be even more difficult if they're unable to seek the companionship from their friends and family because they're fearful of the virus. If we have another year of living with the virus or another year of rolling lockdowns, then we'll be facing an enormous amount of lives lost for years to come. These lives might not be noticeable immediately, but we'll continue to see that in the future years if we don't act now. The sooner we reach zero, the quicker our cancer teams can begin diagnosing and treating cancer at their original pace. And the sooner patients will feel safe to seek the care that they need. Thanks very much.
Thank you very much, Andrew. I think everybody is aware of the impact in terms of patient advocacy groups as well that have been speaking to this challenge and issue since March in particular, and the impact that the crisis is having in every aspect of our healthcare in Ireland and across the island indeed. Paul, if you're available there, would you mind just maybe just giving us maybe some figures and projections in terms of, I mean, this is one of the issues why we decided to call this today, was the absolute urgency of where we're at in terms of the exponential rise in cases.
Well, first of all, I suppose the media just isn't careful. They're not predictions, these are scenarios. Maybe people have reacted already and that will help our figures, but based on trends to date, we're possibly facing over 2,000 cases a day by January 6th among the non-healthcare workers. Eventually that will reach into healthcare workers. The problem with having these high numbers is vaccination strategies become riskier. It'll take longer for them to roll out. We also run with the real possibility of coming across some mutations like we saw with London last week, where when people ask the question, will this affect the vaccine? Eventually, the answer to that will be yes. We cannot run with high numbers. So as long as that keeps running, there's more and more risk of the vaccines not working. We need low prevalence for a vaccine rollout to work successfully.
Thank you very much, Paul. I think a lot of people that are watching this, maybe that aren't medical practitioners or aren't familiar with the maths of epidemiology, would not be aware of that. So I think that's an important point. I'd like to move to Professor Jerry Killeen in Cork, just for some observations, please.
Thanks very much, Nessa. And I'm really glad to be following on from Paul and Andrew, who just have that talent with numbers and the dynamics of this disease. Because one thing I'd like to emphasize is that all of this is predictable. You know, the situation we're in at the moment, you know, the first really good simulations for this came out on the 16th of March. Most of the science and certainly most of the solutions to this challenge are decades old. So a lot of it's a century old. We've talked about Australia. Let's not forget that they quarantined out the Spanish flu. It's the only country that did that. A good old-fashioned stuff. Most of the solutions we need are old. What we just have to do is accept the science. It's stark and it's harsh, and it's not something we're used to where we have such stark choices. But we just need to, the first thing we need to immunize against is wishful thinking. You know, that's been our number one enemy so far. The only exception is, in terms of the responses required, is that the epidemiology of SARS-2 is different from SARS-1 and Ebola. And what that means is that the contact tracing response needs to be different, and it needs to be done at a much more intensive, advanced, retrospective level than anything that's been done before. And what that means is our public health doctors need to take the helm. Currently, they're totally frustrated, they're under-resourced, and they don't have the autonomy to make the decisions that their skills allow them to make on an expert basis. They're on the verge of a strike out of frustration. We need them quarterbacking this thing. We don't need them chained to an oar, doing what they're told and following cookie cutter protocols that are 9 months out of date and which look like they're designed to make sure that we don't know where transmission is occurring. If you don't trace back more than 48 hours, you have no idea where the infection came from, and there's no way that you can capture an entire transmission chain. So, you know, please, let's get behind our public health physicians. We don't have many of them, but they have the expertise to drive this, and to let them take the helm.
Thanks, Jerry. Actually, a question came in, Jerry, there from the Q&A on the question that is the elephant in the room, the internal transmission. And I suppose it brings up that question of community transmission and mystery cases. What are your thoughts on that, from your own experience of having worked in similar contexts internationally?
Yes, well, the reason COVID scared me is that I recognize polysymptomatic transmission because it's very similar to the diseases I normally work with, and that means that you've really got to get community transmission down to zero. And the thing you've got to remember about community transmission is that it's underrepresented in the epidemiological data. So when you see, that a quarter of our cases are community transmission, in reality, that probably means half of all the infections out there. So until we get to the stage where contact tracing, where there's no mystery cases, then there's transmission going on out there and we don't know where it is. And that's why Australia, China, New Zealand, Vietnam, South Korea, they all focus on zero mystery cases as the target. If we have cases, but they're in quarantine, what harm?
Okay. We just got another question in there as well with regards to contact tracing, and it was something that Anthony had brought up at the very beginning as well. The question was, is there a sufficient number of contact tracers in Ireland and are they being effectively deployed? Anthony, would you like to take that question?
Yeah, no, there are not a sufficient number. No, they're not being effectively deployed. We have almost the same number of people in regional public health that we had in March. HSE have been promising since March that they would increase the staffing in regional public health. They have just decided in the last day or two to bring in more staff into regional public health. That's 9 months into a pandemic. So we are not doing it. We have a call center, we have several call centers which are doing good work, but they're not doing the detailed contact tracing. They're effectively setting people up for contact tracing. But with the number of cases we have and the staff numbers we have in the public health services, we cannot do it. So we need a very, very quick, very serious uplift. We can train people to be reasonably effective contact tracers in a couple of days. It's not that difficult. And these would be people working under the guidance and direction of public health consultants. But that's what is needed.
Okay. Jerry, did you have your hand up there as well?
Yeah, I think there's a nice example in the history of our contact tracing system that tells us about the dangers of wishful thinking, is that a large number of the contact tracing teams were just stood down over the summer. It wasn't just a political move. Our authorities actually believed that this was all over, despite the fact that there's half a century of science to say, it wasn't, and that we shouldn't expect it to be. So we've just got to learn to look the devil in the eye and stare right back at him and do what we've got to do.
Okay. Thank you very much. We have another question that just came in again about the border. So maybe Julian Mercy from UCD, I know you've written a little bit about this in the recent weeks. You might maybe just give us some comments on your thoughts on how the border might be bubbled, or we might manage it in a way that protects people on the island.
Yeah, well, every country has their one tricky issue, and Ireland's tricky issue is the border, right? So we're not going to pretend that it's a very simple one, but the fact is that it's manageable. The point here is not to have a hermetically sealed border where nobody crosses. It's just to have it managed, and that will go a long way. Our plan is vetted by very highly placed people in the Garda, so it cannot be dismissed just like that. Those people have told us it's not necessarily easy, but it is feasible if you do it in that way. And so the other thing as well that we always hear is that all people will start crossing the border and we can't block them. In Ireland, the level of public support for measures against COVID is extremely high. Every opinion poll we have is 70% to 85%. we want restrictions, we agree with that. So we can put that aside very easily. There's always going to be one or two people, but we don't make policy based on that. So the key about the border is to realize that it's not that important in a way. If you have a county where the cases are low and you want to protect that county from infection from outside, it doesn't matter if the county is in the deep south or on the border or wherever. It's a county that needs to be protected. So you want to restrict movements into that county. Vice versa, if a county is highly infected, you don't want that to spill over outside. It doesn't matter if you're on the border or if you're near Cork or anything. You want to restrict movement out of that county. And so if you do that, following the data, and you have mobile checkpoints and checkpoints on the main roads, you can really reduce the movement a lot, and it could go a long way, like I said. And the last thing to consider is that any one component of a policy for COVID works well if you have a good master plan within which it's implemented. If you have a master plan like the ISAG plan, which has 7 or 8 components, the one component of the border becomes easy to implement if the other components are also in the same direction. Conversely, if you don't have a master plan, or if you have a plan like living with the virus, whatever you do with one component, the border or something else, travel, it's taking place within a failed strategy. So of course it won't work, but you have to have all the pieces of the puzzle together, and then you know, there's a synergy between the components and it becomes easier. So that's what the plan is with the border. And again, the plan we have is not exactly creative. It's just a copy of what has worked elsewhere. And the good thing about that is that you know that it has worked. Therefore, just be a bit creative for Irish specificities, and then that's what we have to do. So that's how we could proceed for the border.
Okay, thank you, Julian. And I think a lot of discussion yesterday over the airwaves and on the television as well, the different programs, was that, you know, that we've been managing to react to the virus, but we haven't managed to get ahead of it. And that has been really the question of what is the plan once we emerge out of a lockdown, the what next kind of question as well. I might invite maybe Professor Ivan Perry, maybe just to make a few comments, and then we're going to move more into the questions that are coming in. We've lots of questions coming in from the attendees as well. Ivan. You might put your mic on as well, Ivan. Thank you.
So I suppose just to make a few very basic observations. I think we have to come back to the fact that we are fundamentally dealing with a public health emergency, albeit an emergency that has social and economic and political implications, but it is first and foremost a public health emergency, and we can draw on methods and strategies and approaches that have been used in public health for over 100 years, and I think this is just something that we really need to come back to. If there was a major fire in a shopping centre, we would call the fire brigade. We wouldn't assemble a committee of the local dignitaries, politicians, senators, and so on, and have a protracted debate as to what was needed. So I think we really have to come back to core first principles. And I suppose the other point I would make, just picking up on Anthony's opening remarks, Micheál Martin, our Taoiseach, has shown outstanding public health leadership in the past, and I would like to take this opportunity to specifically call on him to to take leadership on this issue at the European level, because it's clear that Europe is failing, and we need a European-wide response to this public health emergency.
Thank you so much, Ivan. Absolutely, and I think that's something as well with the letter to the Lancet that was published, where we had over 300 scientists across Europe arguing for that pan-European response. It brings up the question, actually, I might direct this to you, Gabriel. You know, do we need more international voices in Ireland to look at what we're doing and how can we do it better?
Well, I think that's a very good idea, and I think it would be very useful to have an external diagnostic eye run across the approach that's being taken both north and south. It is very difficult in an emergency like this to maintain enough objectivity and to distance yourself to be able to take a view. So a fresh pair of eyes from elsewhere, I think, would be extremely valuable. And it might also get past some of the blockages between north and south, and the consideration of whose experts are best, north or south. And there are people who would do this. I'm hearing plenty of public health voices across the world, highly experienced people, whether it be in Australia or Mike Ryan in Geneva or Martin McKee in London, who I'm quite sure would be able to provide a rapid diagnostic review of where Ireland is as a whole and what needs to be done. And I think that would be extremely valuable if such a review was placed before politicians and the public, north and south, which clearly laid out an expert, objective view about where Ireland should go. So I think there's great value in obtaining some external objective advice.
Okay, just a question in with regards to that, and numbers and caseloads came in terms of, I think from Roisin Shortall, that what would happen if we go beyond 1,000 cases a day, and how can the Irish healthcare system cope? Would anybody like to answer that question?
I might just point out then, thanks for Roisin for highlighting the issue with staffing in Irish hospitals. One thing I think we've failed to recognise nationally is the number of healthcare professionals that are imminently leaving to Australia and New Zealand. And for people that aren't on training schemes, and for people that are fairly free to mobilise in an English-speaking world and whose degrees are recognised, I know of one hospital where there's 20 junior doctors leaving in January, and normally junior doctors in Ireland leave around July, but if I was a betting person, I would say that these junior doctors are going to leave and not come back until there's some degree of normalcy. So if you've the opportunity as a junior doctor or nurse, and you've the opportunity to work in a COVID-free environment in Australia or New Zealand, then most people are going to take that opportunity. Specifically relating to our question, can contact tracers trace over 1,000 cases a day? Not a chance. That's why you have to get the numbers down. Now, you have to think of this like a surgeon taking out a tumor. He needs to know the boundaries and he needs to know the anatomy. We don't have the data, and it gets back to the distinction between understanding the chains of spread and the distinction between mystery community cases. A mystery community case means you've no idea where it comes from, therefore you can't chase any chain of spread back. And if we're only looking back at fairly short periods and not trying to find the root cause, which we've never done, and it gets back to what is the strategy. Is our strategy to do mild suppression, which ultimately leads to overwhelming of your system, or is the strategy to try and get to extremely low numbers such that you can identify every chain of transmission? Ireland has never taken the leadership to go for every chain of transmission, which is why Australia, New Zealand and other countries have been so successful.
Okay, thank you very much, Oisin. I might move to Anthony there. Anthony, you wanted to come in on that?
Just very briefly, Oisin is absolutely right. We can't trace at these numbers. That's one of the reasons for bringing in lockdowns is to reduce the numbers to the point at which you can control them. Something WHO are not a technique for controlling infection. They allow you to get the scale of the infection down to the point at which you can control it. The other comment I would make is NEFIT have done a lot of interesting work, but they still see themselves as the emergency team. So they're planning their plans are days or weeks into the future at most. Nobody is planning for what happens when it takes from now till next November to bring back the economy. Nobody's planning what it takes from now until next November to stop large numbers of cases of this virus. Vaccination will stop people dying, which is great, and will probably stop people being severely ill, which is even better. But we know from work published today that 1 in 3 people who have COVID-19 who would never go to hospital are left with long-term side effects 4 months later. We don't know how long those will last, but we do know that we need a plan for this disease. We need a plan to get our economy back. We need a plan which is not just reacting to what has happened to the virus over the last week, 10 days, 14 days, which is what we have now. And it's up to the government to adopt such a plan. The plan we have proposed is based on public health experience, has been seen by many people in public health across Europe. And I think Gabriel's suggestion of getting an independent outside expert to review it in detail for Ireland will be very beneficial. But we need a plan. We cannot go on as we are.
Okay, thank you, Anthony. I suppose following on from that, we had another question coming in, I think, from Mark Coughlin, just wondering, I mean, the argument here is that we need to work on the island as an epidemiological unit, and that if we emerge out of our respective lockdowns, but we're not in step, how is that going to affect 2021 on both sides of the border? Sam, do you have any thoughts on David's question?
Yeah, I think that the Belfast Agreement of 1998 gives us a legal framework for governance on both sides of the border and 2 jurisdictions working together. I think the council should be established under there's three ways that council can be formed, and one is to deal with cross-border emergencies, and we're in a cross-border emergency. I would suggest that it has multiple working subgroups, at least one from every department north of the border and south of the border, where you have senior level Assistant Secretary General civil servants talking to each other on a daily basis to share their analysis, their data, but also their discussions around where their public policy is going. So we don't have a situation like yesterday when Robin Swan is complaining that the Republic of Ireland government never told the folk in the north that they were going to stop flights in from UK until they heard it on news or on Twitter. So it is possible to set up this level of communication and dialogue. That can then, when it builds trust and people work together, then we can get joint coordinated public policy, which would obviously be the best way. So there is a legal framework for this, and I'm sorry to say it, I don't think it's been exploited enough yet.
Okay, thank you, Sam. Gabriel wants to come in.
One of the things we've learned during this pandemic is that data is king. And one of the things I think would help enormously would be a joint information analytical function, north and south, to combine data sets to try and iron out inconsistencies and problems in timeliness and completeness, so that we have a full picture across the whole island. That is, I think, one of the things that hasn't been done that should have been done. It's difficult for me to envisage a proper coordination, cooperation, and between north and south without getting the data first, getting that right first. So I would appeal to the 2 governments to immediately establish a tasked analytical grouping to provide an all-island approach on the data, and also perhaps to provide data and an analysis of the experience of other countries that might be helpful to Ireland's situation. And I think that could be done immediately. There are plenty of people capable of doing that if they were tasked to do so by the two administrations, the two jurisdictions.
Thank you very much, Gabriel. We have an attendee, I think, who would like to ask the panelists a question. Debbie, are you there? You can put your your mic on. If it's not working, if you can type it into the questions if you wish. We had one, while we're waiting for Debbie maybe to get her mic going, we had one question about the schools as well. If anybody would like to answer any question about transmission in the schools and concerns about schools reopening after Christmas.
I might address that. We're not collecting data from the schools, first of all. They're being collected by a parent on a Facebook page, which is as astonishing as you might think it is. The evidence from that, and she only collects notifications from school principals to parents in schools. The evidence from that is that most secondary schools and a minority of primary schools have had one or more cases. The way the data are presented by HBSC is from 15 to 24. So it's impossible to distinguish between school-going children who are 15 to 18 and young adults of 18 to 24 in the data. But looking at the school numbers, which were supplied to a colleague of mine, who's also the parent of school-going children, on foot of a Freedom of Information request, a large proportion of the cases in the 15 to 24-year age group are in school-going age children. Because we don't know where transmission is occurring, because we're not asking the question, we can't answer the question, how many cases are arising in schools? But it is clear that schools are a significant part of the infectious burden of this disease. One important point is that unlike influenza, where schools are central to spread and transmission, schools are not central to spread and transmission of COVID-19. And it looks as if primary schools do not play a major part in the spread of this disease. Secondary schools, particularly older children in secondary schools, are more important.
Okay, thank you, Anthony. I think Jerry wanted to come in there as well.
Yeah, I think in epidemiology, it's always important that that you understand where data comes from. We understand what it tells us and what it doesn't tell us. You know, we're always just seeing the tip of the iceberg. So you do need to understand, you know, the density of ice, the density of water, how icebergs behave, etc. And so it's not a job for just people to download data and interpret it at straight face value. And there's two things about the schools we need to be mindful of. First of all, our contact tracing system looks like it's designed not to find out where transmission comes from. That's the first thing. So if it was happening, we wouldn't know. Secondly, for the most rigorous analyses that pool data from over 100 countries and published in Nature, they concluded that the second most important thing you could do to limit transmission and get your epidemic shrunk as fast as possible was to close school. So that figured second on the ranking, even though it's very difficult to associate transmission with schools. And the reason for that is because children are less vulnerable, they're more likely to carry it quietly. So there are open questions there. There was a question came in from one of the attendees about, you know, mobilizing all the volunteers and the people who are out there, you know, and this brings me back to my background in public health in low-income countries. And a lot of that, those traditions are old. They come from old-fashioned public health. And, you know, what works very well in many, many countries around the world is mass mobilization of mass labor. You know, we don't need Gardaí to visit pubs. That just requires somebody with a clipboard, a badge, and a bit of a blessing from the health authorities. You know, when in the cholera outbreaks I've been through, the police don't visit the little informal restaurants and little kind of takeaway joints. It's somebody with a clipboard and a badge, and you know, the police only get involved if somebody doesn't take it well or whatever. And in fact, these systems have been used to not just address public health issues, but also to address employment issues through labor intensive schemes. I think the biggest public health scheme in history was actually the schemes, the mass labor schemes that were used to take America out of the Great Depression. You know, half the public health infrastructure in America was built in the 1930s. And these systems work so well in tropical countries that when they get diverted, new outbreaks happen. So for example, there's a whole army of people around Brazil that deal with dengue on a routine basis. Whenever there is a cholera outbreak, those folks get diverted, and sure enough, there's a dengue outbreak 2 months later. So, you know, the armies of people with clipboards work very well, and with so many people on pandemic unemployment, you know, payments, there's lots of ways that we can use people to deal with the mass regulation that's required, and so that our guards can focus on things like checkpoints, mass gatherings like the car park party that happened in Cork last week. You know, there's much smarter ways to do this. We just need to be prepared to learn and to leave our European exceptionalism behind us.
Okay, thanks very much, Jerry. I'm conscious of the time, so we might go around to if there's any final comments or observations. And Anthony, I might end the session with you at the very end for just some final thoughts, if that's okay. Anybody like to make some final observations? Gabriel?
Just one or two. And the first one is that to say to people that just because the government, whether it be the Assembly government or the government in the Republic, just because they tell you that you can be more relaxed about Christmas and Christmas Day, doesn't mean you have to be more relaxed about Christmas and Christmas Day. And my strong advice to people is that they should treat it for purposes of interaction and social restriction, just like any other day, because the virus will treat it just like any other day. So please, everyone, be safe. I think the second thing I want to say is we have an opportunity because of the position that we're in, both North and South, with increasing problems, to take a unified response and to make it count and to get us as an island to COVID-free to all intents and purposes, which would see us through the next year, as Anthony said. We must not miss this opportunity. We missed the opportunity badly in the summer. A terrible mistake was made, and we must not miss this opportunity. You should not repeat your errors. We should have learned from the error, and we should not repeat it now. Now is the time to really take a grip on COVID and rid the island of COVID.
Thank you very much. I might I'll go to Jerry first, and then I'll move then to Anthony then for just final comments. Thank you.
I'd just like to echo what Gabriel has said, and particularly, you know, emphasize the fact that this new variant looks worrying. You know, the news about this new variant looks worryingly accurate, and there's a very real danger there that a fourth wave will be a much wilder ride than anything we've seen before. And so the risks associated with the resurgence this time around are much, much higher, in a way that have kind of shaken me in a way I haven't been shaken since April. So I just really encourage people that, you know, whatever room we had for fooling ourselves that there was room for half measures, that's gone, that's evaporated. And it's really just time to act fast, because I'd prefer that we never find out what a fourth wave would look like.
And
Ivan,
Nessa, just a very fine point. Can we at this 11th hour finally invest in and support our public health medicine doctors and the public health medicine, the departments. They are at the core of this battle, and they have not got the support they need.
Absolutely. Thank you very much, Ivan. Tomas?
Just to say that conversations like these are happening now throughout Europe. And it is quite possible that over the next couple of months, we will be moving towards a coordinated European response, which is what the letter in the Lancet that this group contributed to was advocating for. We're not doing significantly better than most of Europe. We're just out of step with the story that they're in. That's why we have to deal with our third wave now. And so we have the opportunity to lead in Europe because of the decision that was made in Northern Ireland for a hard 6-week lockdown. But if we don't do this right, we could be playing catch up in February just to go along with the rest of Europe, which I don't think would be a very moralizing place to be in.
Absolutely. And I think that this is one of the key reasons why we called this today, because we have a unique opportunity in time and space, both across the island of Ireland and this morning, to affect real change. So Anthony, I'll pass it over to you for some final comments and observations.
Okay. I mean, to reiterate, this should be our last lockdown. We've had one unnecessary lockdown. This is a second unnecessary lockdown. Let's make it the last. We know what to do. We know how to do it. The techniques and methods we use have been used for about 800 years in recorded history, and probably for a lot longer than that in unrecorded history. We can bring this virus down to a manageable level and then down to zero. But we have to make that choice. We have to accept that there's no pain-free way of getting to zero, but the alternatives are appalling. The alternative is an overwhelmed health service, a permanently damaged economy, a substantial number of dead people, a substantial number of people with chronic illness. That is not necessary. We have a choice now. It is the choice for our government to make. I believe we are in a position to offer leadership across Europe, but we have to make that choice. The government has to make that choice. And I would urge anyone in contact with the government to persuade them to do this. Thank you.
Okay, so I want to thank everybody this morning for Zooming in and for tuning in, and to all our participants and attendees as well. There were many, many other questions that came in. We would love to have had time to answer them all. We know that you have to kind of get everything organized this week between work and home and minding yourselves and your families as well. So what we can do is we'll address some of those questions on our Twitter account, the ISAG Twitter feed over the coming days, and do feel free to contact us via our website as well too. So I want to wish everybody a safe Christmas, a peaceful Christmas, and here's hoping that we will have a better new year to look forward to as well in 2021. Thank you.
Nolik Shona.